Dr. Randall, thank you so much for joining me here live in Dallas, Texas on the Valder Beebe Show. How are you today?
I'm well. Nice to speak with you again.
All right, let's go talk about this healthcare system in America that seems to get more confusing every fall. Let's talk about open enrollment. What the heck is open enrollment?
Well, open enrollment is simple. It's that time of year where millions of Americans are selecting their health plan for next year. And it's a really good time to assess what's going to work best for your budget and your particular healthcare needs, and if anything's changed since last year. Those enrollment periods aren't the same for everyone, so it's important to keep in mind some key dates when you're thinking about the situation. So if you get your coverage through an employer-sponsored plan, like millions of Americans, you're going to want to pay attention closely to that communication coming around this time of year from your employer. You're usually going to have 2 or 3 weeks of open enrollment period for that employer-sponsored plan. Don't wait to the last minute for that one. For Medicare beneficiaries, the Medicare annual enrollment period begins next week on October the 15th, and it runs through December the 7th. You're probably hearing a lot about the Medicare annual enrollment period now. And if you're shopping for an individual plan on the health insurance marketplace, in most states, that enrollment period is going to be between November the 1st and January the 15th.
I remind you to know that Dr. Rhonda Randall, she is the Chief Medical Officer at UnitedHealthcare Employment and Individual. Dr. Randall, so why do we, give me some tips. We've gotten a little bit smarter about these health plans. Let me tell you, the first time I'm thinking it's just really daunting, but you get a little smarter over time. So, but the insurance company, each year they change the plan up. So give us some tips for picking the right plan.
Yeah, you do get more experience in how to navigate making those choices. And you're absolutely right. My first and most important tip is don't wait to the last minute. Plan ahead so that you can assess your needs, your budget, your healthcare situation, and the plan options that are available to you. Many people are happy with their current plan, but you're right, there may or may not be changes. So you're going to want to understand that. The second thing is those terms that can often confuse us and trip us up. The difference between a premium and a deductible, a copay and a coinsurance, what your out-of-pocket costs might be, what you might be responsible for, and what the plan covers. We've put together a couple glossaries to help people navigate that explanations of each of those. The first one is justplainclear.com. And for Medicare beneficiaries, that website is medicaremadeclear.com. And also don't forget to look at other benefits that you might be eligible for. Things like mental health coverage is important to a lot of people. Is the right behavioral health coverage in your plan? Do they include virtual healthcare options for behavioral health? And are they at a $0 copay, for example? Look at specialty benefits. Dental, vision, and hearing are important components of our health. For Medicare beneficiaries, Original Medicare doesn't cover most of those services, but many Medicare Advantage plans incorporate things like dental, vision, and hearing.
Okay. I've got a poster from Facebook. He wants to know what's the difference between, what did he say, a supplemental plan and an Advantage plan. Can you tell me that?
Yeah, that's a common question. So with Original Medicare, you can add on a supplemental plan that they are all different as far as what they'll cover, as far as your out-of-pocket costs to supplement Original Medicare. In addition to that, you will need to choose a Part D plan for prescription drug coverage if you decide that's the best way to go for you. Your other option is to consider a Medicare Advantage plan that will cover what Original Medicare covers, plus often what's in those supplemental plans, as well as incorporating, in many cases, a Part D prescription drug coverage all in one. And the convenience of that is attractive for many people. So there's a couple different options there, and you're right to start asking those questions now, a week before open enrollment begins.
All right, I've got one more for you. This one comes from Instagram. They want to know what's the difference between an HMO and a PPO?
So in most circumstances, an HMO is going to have a defined network that you, for the most part, need to stay in that health plan's network. It can often lower your out-of-pocket costs. A PPO, or a preferred provider or organization, often also has out-of-network benefits. They may be at a higher cost than your in-network benefits, so you're going to want to compare the plans in your area that are available to you to make the decision on the cost and coverage options between both of those.
Dr. Randall, you've been very, very informative. I told my audience that I would be speaking with you, so they had their questions ready. So kudos to the audience. Okay,
Those are great questions.
Cost is top of the mind these days. Do you have any additional tips to help us to get through this period of enrollment?
First of all, pay attention to more than just that monthly premium, right? That's what we have a tendency to really focus on, that amount coming out of our paycheck monthly, or Social Security for Medicare beneficiaries. You're going to want to look at what you might be responsible for out of pocket, like deductibles, copays, and coinsurance. Probably my single best tip in this area is looking to make sure that your doctor is in the health plans network. That can really lower your out-of-pocket costs. If you take medication regularly, you're going to want to check to make sure your medication is covered by the plan. Even if it's covered this year, you're going to want to look into next year's prescription drug list to make sure that if you don't expect to change plans, that there's no change to the medication that you take and whether or not it's in or out of network. There's a couple other things with medications that can save you money too. Staying in a network pharmacy. Home delivered prescriptions can often not only be more convenient, but it can also sometimes lower your costs. So take a look at those options. And then last but not least, look into how you might be able to get rewarded for healthy behaviors, things like exercising, not smoking, completing health surveys. And for Medicare beneficiaries, you might be able to find a plan that includes a gym membership at no additional cost to you.
These are great, great incentives. Okay, as I wrap up, you got a place for them to go online again?
Yeah, we put all of this information available with tips, resources, and information on plans available in your area in one convenient place. That website is uhcopenenrollment.com.
Thank you so much, Doctor. This has been so great, and you've helped so many people, that more than you'll probably ever know. So you guys go online, get your information from Dr. Randall. Thank you, Dr. Randall. I appreciate you.
Thank you. Be well.
Hi, I'm Valder Beebe, host of The Valder Beebe Show. We have over 1,000 videos on ValderBeebeShow.com and YouTube.com/ValderBeebeShow. We upload new videos daily. Our site is a modern baby boomer platform with news and information important to boomers. Subscribe to YouTube.com/ValderBeebeShow and stay connected as I interview the world's most fascinating people.